Hello everyone, welcome to Group 2's presentation. Our members are Wendy, Teresa, Peyton, Allison, Nico, Jenilyn, Jason, and Andrea. Our topic for this project was pulmonary embolism, and we're providing treatment for a pediatric patient. A pulmonary embolism can occur when one or more arteries in the lungs become blocked by a blood clot. Next slide. According to the chart, the patient is a 5-year-old Hispanic female named Sabina Valdez, and she has a history of asthma. An adenoidectomy was performed on her 2 days prior to the appointment, and this procedure has been shown to improve or control asthma symptoms. The adenoidectomy was added under prevention in the EHR. Next slide. In the EHR, to add a prevention, you would click on prevention on the left-hand side of the screen. You would click add new, and then you would fill out the required fields. And in this case, it would be the type of prevention, whether or not you want it to be displayed in the EHR, the subject, and the details of the prevention. After you enter in all the information that is needed, you would then press save and close. Next slide.
The patient was initially brought in by her mother for wheezing and hemoptysis, which is coughing up blood. The patient has coughed up blood once or twice since the adenoidectomy 2 days prior. The patient has an existing condition of asthma and a history of frequent acute otitis media and upper respiratory infections. Hemoptysis was added to the encounters along with the wheezing and to the problem list as the wheezing and hemoptysis was the chief complaint. Next slide.
Upon arrival to the clinic, the patient's vitals were taken. She had a heart rate of 98 beats per minute, an oxygen saturation of 89%, and blood pressure of 85 millimeters of mercury. These were all added to her chart under the vitals tab on the left side. And then by adding new on the bottom right of the corner. Then the values were added to the appropriate boxes, and then you hit save. Next slide.
All right, the pulmonary embolism algorithm was initiated due to the patient's presentation of symptoms along with the diagnostic results. The PERC score is calculated as shown on this picture. She has hemoptysis, an oxygen saturation of less than 93%, and a surgery in previous 4 weeks. Her PERC score is 3. Next slide. The RGS was calculated as shown in this picture. Again, she presents with hemoptysis. She had a surgery within the last month and a heart rate of greater than 95 beats per minute, and her score is 9. Next slide. Can you go back? Okay. Afterwards, the D-dimer test was performed, and it was above the cutoff at 0.5 micrograms. And then she was presented with no known allergies, and for precaution, a ventilator perfusion scan is performed. Next slide. The compression ultrasonography is positive, and there are no absolute or relative contraindications. Next slide. So therefore, we proceeded with the PE treatment. Next slide.
Sabina's current orders are shown here. The screening and measurements and scheduled meds are present from a previous visit. As part of the diagnostic procedures, the patient had a ventilator perfusion scan. A positive compression ultrasonography, or CUS, was documented in orders under the category diagnostics. The CUS result was compared to the algorithm for further action with the patient. Sabina came in with an oxygen saturation of 89%, so she was placed on an oxygen mask. The oxygen therapy was added to the orders list. The remaining orders were placed after following algorithm 2 and were added to the orders list under laboratory and ECG under diagnostics. The vital signs needed to be monitored every 15 minutes, which was categorized under care. Finally, the heparin order was noted in the description. Next slide. This slide shows the EHR Go page for entering orders. To get here, you would select New. The required fields are denoted by an asterisk and have to be filled out for each order. Once the order entry screen is filled out, select Save to save the order to the patient's chart. Next slide.
So moving on to the second algorithm to determine how to treat pulmonary embolism, the calculated PESI score for the patient is 65, and we got this number by using the first photo on the slide. We added the patient's age, which is 5, another 10 points for chronic lung disease, and another 30 points because her systolic blood pressure was less than 100 mmHg, and then another 20 points due to her arterial oxygen saturation, which was less than 90%. So that's the total, 65. It is less than 86. Next slide. Proceeding to analyzing if any of the criteria was met, the third and fourth bullet meet the criteria due to her oxygen saturation level being 89% and her blood pressure being 85 mmHg. So next slide. We proceeded to ordering the following labs listed on the first page, or the previous page. On the EHR Go, we entered the order under labs, which you can see on this slide. Next slide.
So since the patient has been diagnosed with high-risk PE, we're going to admit Sabrina into the ICU. We're going to start heparin and give the systemic thrombolysis. Next slide.
Okay, the order details they show here for the treatment for high-risk pulmonary embolism. Medications started were heparin of 10,000 units and D5W water of 500 milliliters. The dosage being 25,000 units, we were starting this to be an intravenous route, and the directions to start the IV heparin now. Next slide, please. Continuing on the orders details, we made sure that we had the heparin of 10,000 units, the D5W 500 milliliters for our medications. Next slide, please. And due to the high-risk PE, we went ahead and began an admissions note to admit the patient to the ICU, documenting this in the notes section of the EHR for the admission plan. All the provided information comes from what we've done through all the algorithms. So we're going to show you where we put all the information for the admission. Next slide. So here on the left-hand side, you're going to click on notes, and then you'll actually choose the admin note. And click on a new note there to start that new admission plan note. So you see on the top slide there. Next slide. Basic information we're starting off with, the location, the date and the time, and the author. Next slide. And then what we're doing is we're sending them to the ICU. We've diagnosed them with an acute pulmonary embolism. Next slide. Right now, their condition is stable. We got them on vital signs Q15. We do have them on bed rest, so that way they're not getting up, moving around. Next slide. We have them with non-rebreather mask for their nursing because of their O2 saturation being less than 90% on room air. They right now are not allergic to any medications that we are aware of. Right now, their diet is PO, so that's by mouth. Next slide. The IV fluids we do have are the D5W, which is sugar water, 250 milliliters, and we're going to keep the vein open, KVO. Heparin's 25,000 units of IV, and then the labs we've already ordered are the troponin 1, the basic metabolic panel, the complete blood count, and we went ahead and ordered those now. Next slide. The specials are the electrocardiogram, and we're performing the systemic thrombolysis to try to thin out the pulmonary embolism in the patient's lungs. We want to try to do, we want to avoid surgery, so we're going to do medication therapy, and we're going to monitor the patient. Next slide. And then finally, once we've done with all of our treatments and what we've already done with all of our medical care, we need to provide the prognosis and a family update. Our patient is a 5-year-old pediatric patient. Parents are going to be very worried, so we need to let them know what the prognosis is. And right now, we do have a good prognosis as long as the patient tolerates their treatment. The family would need to be updated. We can let them know that the patient is currently tolerating the treatments well. We did catch this in time. PEs can be fatal if they're not caught real soon. And barring any unforeseen circumstances, the patient should make a full recovery. The final part about this is that this is more than likely one of the hardest things to do in medicine specifically, just because if you have to deliver bad news, it's really a hard thing to do to try to deliver that to a parent of a pediatric patient. So hard thing to do, but in this case, it looks like we do have a good outcome. And that's it.